Buhay pa, Doc. Buhay pa ito, pwede man share. Okay.
Yeah.
Sí. Siya niya.
Okay.
Sí. Manaka lang to man. Yeah, very good. Thank you.
Okay. So, this is my topic for today, diabetes mellitus. This is actually the very, very common condition. This is the 5th cause of death in terms of mortality. What is diabetes mellitus? It is a metabolic disorder that's causing a spike in blood sugar level for a prolonged period of time. We have 8 base factors of diabetes. We have 40 years old and above, inactive lifestyle, high blood pressure, gestational diabetes that is related, a high blood sugar that is related to gestation, related to pregnancy. Number 5 is impaired glucose tolerance. It is a pre-diabetic state before the onset of diabetes at 126. That is less than 126 milligrams per dl. Then we have number 7, abnormal blood lipid level. And then we have another one, obesity. And then the last one is family history. We even have actually 9 for us Filipinos. We have about 9 risk factors because we are white rice eater. Okay, that's another risk factor. This was a study was presented at British Medical Journal last year, September 27, 2022. They compared white rice and the brown rice. Their conclusion is the intake of white rice was associated with higher risk of type 2 diabetes, while intake of brown rice was associated with a lower risk. But of course, it's not to say that we cannot eat rice, but we have to eat in moderation. Okay. As you can see, there's a comparison here with different food for high glycemic index. When we say high glycemic index, this food will, when it's high, it's very easily digestible, and the starch would be very fast in converting into glucose. Okay, that's high. Comparing to the basmati rice or brown rice, actually it's much lower glycemic index. Okay, here is the comparison. This is the comparison. Here we can see the glycemic index that is very high. Is you can easily release the energy. You can release at you can be hungry right away because it would cause postprandial hyperglycemia right away. The sugar will spike right away. Comparing to a low glycemic index food, it's less soluble. That means it is absorbed very slowly. and you become fuller after a meal, and you will eat less. We have three types of diabetes mellitus. We have type 1, type 2, and the third one is gestational diabetes. Type 1 diabetes. This is a result of pancreatic failure to produce enough insulin because the beta cells is being destroyed. The beta cells are the one who are producing the insulin in our body. It's being destroyed because of the immunologic response of our body. Autoimmunity will destroy our own, although the cause is still unknown, but it is actually our own body is destroying the beta cells. So there'll be deficient in the production of insulin, and then that's why the treatment really for DM type 1 is only insulin. Okay, that's why the previous name of type 1 is insulin-dependent diabetes mellitus, which is IDDM or juvenile diabetes. Okay. Okay. There's a comparison between type 1 and type 2. At onset, if sudden in onset for type 1, for type 2 is gradual. Age at onset for type 1 is mostly in children. Age at onset for type 2 is mostly in adults. For body size, usually they are thin or normal in body weight for type 1. Mostly for type 2, they are obese, but usually they start out as obese, then later becoming thin. And then ketoacidosis common for type 1 and rare for type 2. Then here is the part that I'm talking about, the immunologic response, the autoantibody, where within our own antibody will destroy our own beta cells. It's usually present when you check the blood. And then for type 2 is absent. And then for endogenous insulin, we have low or absent insulin in our body. But for type 2, we have normal, depending on the stages of the diabetes, normal, decrease, or increase. Later on, I'll show you slides to explain it. And then concordance in the identical twins is 50% for type 1, 90% for type 2. Rebalance rate, wow, it's a very big difference. 90% for type 2 diabetes, only 10% for type 1. This is what I'm talking about, the natural history of diabetes. The insulin level at onset is normal. And then as the diabetes will develop, the insulin, because of insulin resistant, because there's the cell is resisting the action of the insulin, our body would compensate to make more insulin. That's why it is the phase of hyperinsulinemia. And then later on, to a point where it breaks. When it reaches the breaking point, it causes pancreatic exhaustion. Then the pancreas will drop in producing the insulin. And then that's why type 2 is, even if it is, the previous name is non-insulin dependent diabetes mellitus, but still diabetes type 2 also have insulin requiring patient. Okay. So here's the third type of diabetes, which is gestational diabetes. Is the third main form, and occurring in pregnant women with without previous history of diabetes. So how do you diagnose diabetes? It's very simple. You just follow the normal of monitoring guidelines. Normal is fasting sugar of 70 to 100 milligrams per DL. And then post-meal, we're talking about 2 hours after meal, which is 70 to 140. And then for pre-diabetes, this is the IGT, impaired glucose tolerance at 101 to 125 milligrams per DL. And the 2 hours after meal is 141 to 200 milligrams per DL. But for diabetic, this one is supposed to be 126 and above. 126. And for 2 hours after meal, that is 200 milligrams per DL. Signs and symptoms, we have the classical presentation of diabetes, which is weight loss. That's very common. Polyuria, increase in urination. Polydipsia, increase in thirst. Polyphagia, increase in hunger. Complication for uncontrolled diabetes. We have 3 most common life-threatening complication of DN type 2. Number 1 is heart attack, heart disease. Number 2 is stroke. Number 3 is kidney failure. But for other conditions like peripheral neuropathy, it attacks the nerve. This is actually the most common complication, the peripheral neuropathy. The patient will present with numbness and the shooting pain of especially the lower extremities. Then we have the disabling complication, which is the diabetic foot ulcer, the diabetic foot, diabetic gangrene, foot gangrene. This is the mechanism behind the complication of our diabetes. It's the glycation of the protein. That is actually simply that when you have high sugar for a prolonged period of time, the sugar will destroy the protein. It will destroy the protein. It causes glycation, causing the end product really is advanced glycation end product. That's why you develop heart problem, you develop a stroke, you develop kidney failure because of this pathological basis. Okay. The impact of diabetes mellitus is the leading cause of non-traumatic lower extremity amputation. That's one. Leading cause of new cases of end-stage renal disease. This is patients who undergo dialysis. And then we have the leading cause of blindness, new cases of blindness. And then 2 to 4 increase in cardiovascular mortality. Diabetes is managed, but it does not go away. Okay, but for early patient or even moderate cases with M3 and Fulgent placenta, I can say diabetes is treatable. Not only managed, is treatable, and it does go away. Okay. Okay, here are the management of diabetes. You A1C below 6 or equal to 6. Fasting blood sugar less than 100. 2 hours after meal less than 140. Blood pressure of less than equal to 130 over 80. Fat cholesterol 100 milligrams. Triglycerides 150 or below. And then good cholesterol of more than 40 milligrams per DL. This is actually the second complication of diabetes I'm presenting. The last time I presented, that is a chronic kidney disease, that's kidney failure. This is the second complication. This is the peripheral arterial disease, or when there's already obstruction, it is called peripheral arterial occlusive disease. Okay? What is PAOD? PAOD simply is this atherosclerotic plaque of the arteries of the extremity, especially the lower extremity, is resulting in exercise-induced ischemia, causing claudication is pain when there's an extension of the lower extremity, leading to ulcer and ganglion formation of the lower extremity. Okay, we have
You have to pay 75 to use the system to do some research. You have to pay 7,500.
Sorry about that. Hindi ko ma-identify dito sino ano.
Can I continue? Hello?
Yes, please.
Okay, the risk factors for PAOD, peripheral arterial occlusive disease, is diabetes, hypertension, hyperlipidemia, family history, sedentary lifestyle, and tobacco use. This is actually smoking. This is actually the most important risk factor, the greatest of all the cardiovascular risk factor. This damage directly related to the amount of use. That's why we doctors would use it as pack years, number of years. How many packs do the patient use per day? Then we times it number of years. That's how we compute for number of pack years. Yeah. Because for a smoker, even if you're not diabetic yet, but if you are really that bad, if you are a chain smoker, you will develop Buerger's disease. Buerger's disease is a gangrene of the lower extremity. Claudication is the muscle pain due to lack of oxygen that triggered by activity. This is very synonymous with the heart. With the heart is stable angina. It causes chest pain, the stable angina, when there's exertion, when you do activity. But without activity, the chest pain would be relieved. The same way with the claudication, the muscle pain during activity. Or here's the symptom. Another symptom, the ulcer on the toe, the web spaces. We have gangrene of the toes and web spaces. We have atrophy of the muscle, loss of extremity hair, and thickened toenails. Pulses. And then if you use a stethoscope, you can hear the bruit. There's a sound that you hear. We call it as bruit when we auscultate the abdominal aorta, the femoral artery, or there is absence of pulses in the which signifies arterial obstruction proximal to the area palpated. This is a comparison of blood vessel is comparing the ABI. ABI is ankle brachial index. You get the blood pressure of the ankle and the blood pressure of the brachial area of the arm. Usually there's no changes when it's healthy, but when it's atherosclerotic, the patient has atherosclerosis of the lower extremity, there's reduction in the pressure of the ankle, such that it will cause elevation, decrease in the ABI. This is actually the ABI, ankle brachial index, 0.7 to 0.9, mild condition, 0.5 to 0.69, moderate condition. When it's severe, that's less than 0.5. Risk factors modifications, very similar with diabetes. You control hypertension, diabetes, and lipid control using a statin. Okay? Then the most important really is exercise program, because if you don't have any exercise program, it will get worse. The PAOD will become worse. So it's recommended to do 1 hour per week, 2 to 3 times daily, gradually increase your exercise activity with as tolerated. Okay, no smoking. Okay, here is my case. A 66-year-old from La Paz, Zamboanga City, who came in with a chief complaint of gangrene formation of the left leg and foot. Diabetes, main diagnosis is DM type 2. With three complications: diabetic foot gangrene, left secondary to PAOD. Then we have CKD, chronic kidney disease, secondary to diabetic nephropathy. Then we have the third complication, which is peripheral neuropathy. Treatment, I use a conventional treatment, piperacillin, tazobactam, Q8 hours, clindamycin, cilostazol to increase the blood supply of the low extremity, atorvastatin, that is statin to control the cholesterol. And then I use M3 factor, 700 milligrams, capsule 3 times a day, and Fulgent placenta cap 3 times a day. And here's the star of the show, which I use for my patient. You'll see the difference really. I present the pictures of the documentation I present. This is the Fulgent Wellness Corporation flagship product, the deer placenta extract at 200 milligrams, together with the other 11 active ingredient, the Swiss apple stem cell, which is very good for the skin, Fucoidan extract, very good for immunity, the marine collagen, which supports cartilages in the bone, and then we have anti-inflammatory agent in the form of avocado extract, evening primrose, rosehip extract, and I think that's it. And the squalene, yes. And then we have the brain protector, which is citicoline, and then antioxidant, and the xanthone, mangosteen, and a very powerful antioxidant with an ORAC value of 895 in the name of muscadine extract. Then we have the M3 factor, which are also used to correct the genetic code of the patient, the genetic code of the diabetes. So I use M3. It is composed of muscadine, mangosteen, and maca. Okay. Here's the reversal part, which I present. The reversal of diabetes type 2 and chronic kidney disease and peripheral neuropathy. When the patient appeared to me, came to visit the first time on October 15 last year. Before that, she did consultation to a different doctor. But sugar is 200 to 300, between 200 to 300 milligrams per day. And then The patient was placed on glycoside 60 milligram tablet before. But when she came, the sugar was already controlled, 99. But the problem is the kidney, the creatinine is already increasing. That's why I put the patient on entry factor and Fulgent placenta. After 1 month, I noticed that the patient complains to me of cold sweats and feeling very cold. So I checked the sugar and it's registered to be very low. So I have to remove the oral medication, which is the glycoside. I have to remove it. So I continue on with entry factor, Fulgent placenta. At the third month, you can see the creatinine went down, 1.27. And then all the numbness, after the third month, numbness and the shooting pain are gone. Okay? Then this is actually the complication the patient came in. This is diabetic foot gangrene. Then 10 days after, did you see it? 10 days after, I have to do the treatment every day. I have to remove all the dead tissue every day. Okay. 1 month after, November 18, 2022. As you can see, there's already neovascularization. The pink one I already the new blood vessel that's being formed. And then 2 months after, there's already contraction. That means there is the lower the leg is becoming smaller. No? Then 4 months after, it's almost closing now, this one. And then 5 months after, and the lateral side is closed. Supposed to be when I treat this one without Fulgent and M3, it will take more than a year to close, unless you do the grafting. You do the grafting. Okay. Okay. Thank you. I think that's I want to thank you for listening to my presentation.
Thank you very much, Doc Roger.
Yeah.
So very dramatic. Wow, that's amazing. So friends, ladies and gentlemen, you haven't seen something like this, okay? But now it's the presentation of our very own Dr. Roger Fernandez. And you can see all the pictures, okay? Yun yung maganda kay Doc, eh. It's all documented, no? And you could actually see yung progress ng patient. Very, very good. Doc, I haven't seen this one yet. Galing. So, okay, if you have any questions, please raise your hand. Meron pa tayong isang tanong dito sa chat box natin. I strongly encourage you to come up with your questions right now. Everything is for free, okay? Samantalahin natin na naandito si Doc Roger. And diabetes, mind you, is one of the most prevalent conditions ng ating mga patients. Okay, we have encountered so many people with diabetes sa Fulgent Wellness Corporation. And now, thanks to our doctor, meron po talaga tayong basis na pwede nating sabihin. I was very struck when Doc Roger said, together with, of course, yung medication, but together with M3 factor and Fulgent placenta, diabetes mellitus 2 is now, sabi pa nga niya, treatable, not just manageable. Talagang, Doc, makikita talaga yung improvement. As in, the talagang treatable nga.
Mm.
Doc Roger, there's one question here. Is it all right to take placenta and M3 together? Placenta has two components present in placenta already. This is from Leia Lara.
Yes, actually, you need to take together. You need to take it together because placenta itself is cell replacement. You replace the cell. But you need to correct the genetic code of the patient. You need M3 factor because of histidine. That's a very potent antioxidant. Then after correcting, the Fulgent placenta will replace the cell. That's already corrected.
So what you're saying, doctor, is una muna yung M3 factor to correct the genetic code of the cell. Tama po ba?
Yeah, I usually give it together. Always
Together. Okay. Okay. Thank you. Sonia Timpu, you're raising your hand. What's your question, ma'am? You can unmute yourself.
Okay. Doc, yung question ko po, yung sa placenta ba, pwede po bang 2 capsules, tapos ganun din sa M3 factor for 3 times a day para for fast recovery, or just one only each 3 times a day?
Dahil for me, I think if you double it, the better. That's the better. Because depending on the financial capability of your patient, if your patient doesn't really have the money, you will advise one 3 times. But if your patient has money, you can advise 2 capsules 3 times a day.
Okay. So that is the maximum one. You cannot take even 3, just 2. Just 2, 3 times a day each. Placenta and then the M3.
You can still go up to 4.
Oh, really? You can take even 4 each 3 times a day, you mean?
Yes.
If you have the budget? So
Yes.
there's no such overdose?
No.
Okay.
No problem.
Talk
Especially,
another.
Okay. Doctor,
sorry.
let me
especially
ask you one thing. If you are taking this supplement, how much is the requirement of protein per kilogram?
what?
Do we need to limit the protein intake daily requirement? If, for example, I'm taking the maximum one since there's no overdose, what
No.
is the requirement of daily protein per kilogram?
Limit protein intake as long as your kidney function is good, no problem. Otherwise, if you have kidney disease, your protein requirement should be only one match pack size of meat.
Ma'am Sonia, thank you very much for your question. Let's give chance to others as well, and we'll get back to you, Ma'am Sonia. Prepare your questions again. Thank you. Sa chat box po natin, there's another question here. What is the advisable intake of placenta with diabetes, and what is the advisable age to take placenta? Thank you po. This is coming from Myla De Torres.
Since most of the patients we encounter is type 2, diabetes type 2. There's no limit. Usually, the patient would come to you as adult. They would not come to you as pediatric. There's no age limit. I think even at 30-something, 36 years old, you can start the placenta. No problem.
Doc, what about other conditions? Let's say, for example, bata pa yung patient.
Type 1, you're talking about type 1. Type 1 is very rare, not very common. So you can start with type 1 at 1 capsule 3 times a day.
Thank you, Doc. Another question, anong oras magandang inumin ang H-Life Glutat M3? Before meal or after meal?
For me, yung M3 is after meal. Together with H-Life is after. The placenta usually recommended before meal.
Thank you. Ma'am Sonia, do you still have another question? You're still raising your hand. And we would like to invite others as well. If you have any questions, please raise your hand as well. Tulad ni Ma'am Sonia, no? We will entertain your questions. And we only have a few more minutes. Maximum hanggang 5 p.m. po tayo. So take advantage of this opportunity. There's a question from Melvin. Sa IDD patient, ano po ang tamang supplementation intake?
That's the old name for diabetes type 1, diba?
Oh, okay.
Insulin-dependent diabetes type 1. Depending on the age, below 10 years old, I think you can give the patient 1 capsule 2 times a day. For more than 10 years old, you give that 1 capsule 3 times a day.
We do have another question here. Arler Eagle Oreto. Doc, just recently I have a patient with prostate problem and the doctor's advice is that he undergo operation. The patient is unlikely or does not want to undergo operation. The patient wants to try Fulgent placenta and M3 factor. Ano po kaya ang mai-recommend na tamang intake sa kanya? So this is prostate problem.
Yeah. Depending on the condition, if you're talking maybe like cancer of the prostate, I would recommend like 4 capsules 3 times a day. But when it's benign prostatic hypertrophy, the benign condition of the prostate, you can give the patient 2 capsules 3 times a day. That's enough.
Thank you, Doc. Ma'am Parilla is asking, sa may pacemaker, ano po ang magandang advice for our products to take?
For pacemaker patient, M3 and Fulgent placenta at 2 capsules 3 times a day for Fulgent placenta. But for M3, 1 capsule is enough. 3 times a day is enough.
Doc, here's a question. Pag yung valve niya ba ay pinalitan ng plastic, can he or she still take Fulgent placenta and M3 factor?
What plastic are you talking about?
Yung sa heart, yung valve papunta sa heart.
Okay. You mean valve replacement. Actually, you can take Fulgent and Fulgent and M3 at 1 cup 3 times a day is enough.
Thank you. We would like to acknowledge the comments of Anton Humilde, a very good friend of ours. He's been with us sa Zamboanga for once, and we're looking forward to Tony. We hope that you can come back to Zamboanga one of these days. Okay, Joylene is asking.
I would love to, Sir Dan, and commendable hosting. Job well done. Thank you. Congratulations.
Thank you. Looking forward to it. So Joylene is asking 3 times a day. Dati akong umiinom ng Fulgent placenta pero sumasakit ang tiyan ko. May rheumatoid arthritis. Siya. Kaya ginawa niya 1 capsule na lang ang inom. Gagaling pa ba kung 1 capsule a day lang ang iniinom?
I think it's not enough, but you have to investigate why are you having an epigastric pain. You need to, are you taking steroids?
Ma'am Parilla, if you can elaborate. Dami na pa ng mga tanong dito.
Maybe she's taking a steroid.
Si Joylene. That was Joylene. If you want to unmute. But if not, well, okay. So Jane BC is asking, good afternoon, Doc. How many capsule placenta and M3 factor will you recommend for stage 4 breast cancer? And kailangan bang uminom ng H-Life? Thank you po.
Yes, you need to take H-Life together with N3 factor and Fulgent placenta at 6 capsules 3 times a day.
6 capsules 3 times a day. Natinig niyo po, ano po? And I'm witness to that as well because when Doc Roger gives sa mga cancer patients, akala natin yung mga 2 capsules 3 times a day lang. No, it goes 4 capsules 3 times a day. Kaya napaka-effective yung ano ni Doc yung dosage niya. Okay. Doc, here's a question from Leia again. Is it okay to take placenta, vitamin C, and fish oil together?
Placenta, fish oil.
Vitamin C and fish oil.
Yeah, no problem. Yeah.
Okay, thank you. Bonifacio Margasino is asking, isa akong diabetes type 2, nag-insulin po ako. Pwede po bang pagsabayin ang Fulgent placenta and M3 factor po?
Yes. I think better if you can combine with H-Life.
Okay, Sonia Timpug is asking, I'm not really familiar with this. What if you are having 3 stents in your heart? How many capsules to be taken?
2 is enough. 2 capsules 3 times.
Okay. Ano po yung stent, Doc? Because I don't know this.
The stent is actually like a, what do you call it? I don't know how to explain it. It's like a tube. It's a
Okay.
tube that will keep the artery open. Diba? If you have a heart angioplasty, they will put a very tiny tube so
Okay.
that it collapse it will not cause atherosclerosis again. Okay.
Thank you. Got it. Melvin is asking regarding throat cancer stage 4. Ano po ang best supplements and the dosage? Also, the right diet, if you can.
The right diet for cancer, I think,
Throat cancer and stage 4.
not to eat meat. You refrain from eating meat because meat is really is inflammatory. That will you take the substitute for meat like the tofu, and then for the right dosage for Fulgent placenta is for me depending if it is stage 4 you give 6 capsules 3 times a day, and then stage 3 4 to 5 capsules 3 times a day. Then for N3, you can go as high as 2 capsules 3 times a day for stage 4.
Thank you, Doc. Maris Keriazon. Hello, Doc. Pwede ba yan sa may liver issue like namamanas ang placenta at H-Life? Ilang capsules if pwede in a day?
Yeah. For N3 factor, you need only 1 capsule for liver problem. And then for the Fulgent placenta, 3 times a day, 1 capsule. And then for H-Life, 2 times a day.
Can you repeat that, Doc? Medyo maganda. Maganda yun at naiiba yung dosage ninyo. Pag may liver issue, anong binibigay natin?
Liver issue, when it's fatty liver, I'm sure you're referring to fatty liver, no? Fatty liver is very common. The most common condition of the liver is fatty liver. So I usually give H-Life 2 times a day, M3 factor 1 capsule 3 times a day, Fulgent placenta 1 capsule 3 times a day.
Thank you, Doc. How about for cancer patients? This is coming from PCE, AD69. For bone cancer, what products is ideal to take and how much dosage is required?
It's still the same. I would recommend 6 capsules 3 times a day.
Alfred Esgracial. May tanong po ako, na-stroke siya pang second time. Sabi ng asawa niya, nagsuka daw at di na makatayo at nagdugo sa utak. Kaya pa ba ng stem cell at M3 factor kung ganyang situation?
Yes, only in a controlled environment. When I'm saying only in a controlled environment, when he's taking the right anti-hypertensive medication. So if you need to control the blood pressure first, then you take M3 3 times a day, 2 capsules 3 times a day, Fulgent placenta at 4 capsules 3 times a day.
Thank you, Doc. Of course, for the benefit of our affiliates, kung si Doc nagpre-prescribe ng ganito, he is not just limiting it sa Fulgent placenta and M3. It's always in combination with your medication, Doc, right?
Yes, yes. You have to combine it. You don't advise the patient to stop the medication because the patient will die if you stop right away, because our supplementation is there to supplement our conventional treatment.
Thank you, Doc. Evelyn Aranda. Good afternoon, Doc. Just like to ask what products are good for someone who has anxiety or depression?
For anxiety disorder, for anxiety, you need to take, other than this one, you need entry factor. 3 capsule, 1 cup 3 times a day.
1 capsule 3 times a day. Thank you, Doc. So we can, there's still room to entertain 1 or 2 more questions, and then we're going to hear from probably I'll call in Sir Anton or Sir Joe. Okay, Leia Lara, I'm taking placenta, and one of the benefits I noticed is I don't experience exhaustion. I don't feel tired throughout the day, and even though I sleep late, the following day still am energized and do not feel worn out from the previous day. What ingredient of placenta that contributes to this?
Can you say it again?
So one of the things Leia Lara notices is she has the energy to go through the day. So wala na, hindi na po siya napapagod. Okay? And kahit na kulang sa tulog, ang tanong niya po is, ano kayang meron sa placenta? Kung bakit may energy siya at saka kahit na kulang yung tulog ay may ano pa rin, go pa rin siya ng go for the day.
Actually, the placenta itself is the one helping her. Is replacing the cells that is being, for example, kulang sa tulog siya, and then it's replacing the brain cells that being damaged. So she will become energized with that. Aside from the 11 active ingredients.
Thank you, Doc. Ano pong pwedeng mai-recommend para sa mataas na BP and creatinine at saka laging nahihilo?
For high blood pressure, you cannot replace that with conventional treatment. You need to have the conventional treatment. We have amlodipine, losartan, telmisartan, whatever. But once controlled, you combine it with M3 factor and the placenta. That will better much control it in 24 hours.
Thank you very much. So that's good to know sa mga merong mga high blood. Doc, pwede bang bata na, pwede ba yung M3 factor sa mga bata? Tanong ni Evelyn Tan.
Yes. Pwede. How old?
What's the minimum age, Doc, na pwedeng uminom ng M3 sa experience niya?
He gave us as young as 5 years old.
Thank you, Doc. Alfred Engracial is asking, I have a coworker sa ngayon nagdadialysis. kasi na stroke. Okay, before mild stroke, after stroke, puro synthetic ang iniinom. Sabi ng doc, nasira na daw yung kidney at ang result ng dialysis ay MFW. I'm not really sure what you're saying, Alfred. Okay, Okay, Monday for MFW session, nakaka-recover pa ba? Alfred, if you can unmute yourself and could you please explain this further? I'm not really sure what you're asking here. Thank you, Alfred.
Actually, it depends on the kidney size. If the kidney size is less than 9 cm, you cannot reverse that anymore because the kidney are already fibrosed, filled with fibrosis already. There's no space for the Fulgent to inside the kidney. Depende how high is the creatinine, what's the ultrasound results, depende.
So Doc, what you're basically saying is once the kidney is also, kumbaga, ano na talaga, shrink na, totally shrink.
Yes.
Mahirap nang maano yun.
Yeah, you cannot reverse that anymore.
Thank you, Doc. So, mga ka-Fulgent, you heard that, okay? Tingnan natin yung kidney size. Don't just keep on giving entry factor and Fulgent placenta. This has, and of course, si Doc Roger naman is one call away. Doc, how do we get in touch with you, by the way?
You can buy a Bible, you can call me, or by a messenger, you can call me, or you can just leave a message and then I'll call you.
Do you also accept yung teleconsultation?
No problem. You can call me at my Globe number, no problem.
Okay, so we're going to share Doc Rogers' Globe number, and pag kailangan nyo ng consultation, like you can leave a text, okay? And si Doc naman, he's always very proactive, and kung hindi siya available at that time, he's always going to get back to you at a later point, okay? So feel free. Doc Roger is a very, very good guy. He's a good friend. Wag po kayong mag-atubili. Okay. So there are still so many questions here, but we're running out of time. Okay. So two more questions. Asuncion Habiliana is asking, if lumalaki ang puso, nahihirapang huminga, may gum disease, how do you treat it?
That means the patient has congestive heart failure. Depending on the ejection fraction of the patient onto the echo, it can be treated yet. Just the early congestive heart failure or moderate congestive heart failure, I think you can still treat it using the Fulgent placenta and M3. M3, you can give that at 2 capsules 3 times a day, and Fulgent placenta at 4 capsules 3 times a day.
Thank you very much, Doc. And sa lahat po ng mga nagtanong, thank you very much for your participation. While we would love to answer all your questions, but we're out of time right now because it's 5 o'clock. So let me hear from Sir Joe Sargumba. Sir Joe, may sasabihin po ba kayo? Once again, Sir Joe, salamat po talaga sa oras na binigay ninyo. Ano po?
Okay, medyo paus po ako ngayon, Sir Dan. Kaya thank you, Sir Dan. Napakagaling niyo po mag-host. Napaka-orderly. Thank you po. Thank you. Sa ulitin po. And to Doc Roger, sana po Doc, di kayo magsawa. I'll be coordinating with Sir Dan sa next schedule po natin. Maraming salamat po, Doc Roger, sa patuloy na pagsuporta. And this is what I've been telling people every time I conduct a BOP, na doing Fulgent business is very fulfilling because tayo nakakatulong sa marami, no? And hindi lang sa kumita kundi sa mga taong na bahagi na natin sa Fulgent business, natulungan natin sila sa aspeto ng kanilang kalusugan. And from time to time, para po sa lahat ito, from time to time ang company ay nagpapapromo, i-grab nyo po yung promo. Kasi nung hearing what Dr. Roger said regarding the dosage, talagang mapagastos ka, no? Para may epekto, ang dosage na nirecommend niya ay more than dun sa recommended dosage nga na nakasulat, dahil may dahilan si Doc Roger kung bakit ganon. So imaginin mo, kung hindi nakapromo, so talagang mahirapan na ituloy-tuloy. Kaya yan lang po ang mai-remind ko sa lahat, na pag may promo tayo, i-grab nyo po kasi hindi po basta-bastang babalik yan. Hindi naman din po pwede na lagi na lang nakapromo kasi may costing implication din po yan. Naka-costing na po yan. Baga ang sa amin lang, pagbigyan lang namin yung mga request, no? Kasi may request na ganito. So yun po. So medyo pause po ako ngayon. Di ko na po habaan para hindi maano yung throat ko. Again, Sir Dan, thank you so much. No? Thank you so much. And Sir Roger, maraming salamat po. Wag po kayong magsawa for being our main doctor. In fact, the only doctor sa Doctor's Hour, sa FWC Doctor's Hour. Thank you po. God bless everyone.
Thank you, Sir Joe. Thank you once again, Doc Roger. And with that, ladies and gentlemen, let's call on Chairman Convince to close the meeting. And again, nagpapasalamat po tayo sa lahat. God bless po. Chairman Convince, please lead us into the closing prayer. Thank you.
Very informative. Thank you so much, Father God, for giving us this 1 hour, even more than 1 hour, to learn more about the benefits of our product, Fulgent Placenta, M3 Factor, and H-Life. Grant, O Lord, that these dosages that we heard from Dr. Roger will be implemented and much more. Use it to the maximum effect so that so many of our friends and patients, our members, can also use it for the benefit of their families. Grant us, O Lord, to be your conduit of blessings to at least 1,000 people each. This is our prayer in the mighty and almighty name of our God. Amen.
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 Thank you, everyone.
Thank you.
Bye-bye. Thank you. Salamat po.
Thank you.
Sir Ton, salamat.
Salamat